SUT is an acronym and stands for Self-Operated Endovaginal Telemonitoring. This concept has been developed over a number of years at the University of Ghent in Belgium, and has then been taken over by a company, Sonaura, that is providing this service worldwide to women who want to use it. It's a system that allows women to make themselves at home or wherever they want, when Wi-Fi is available, their own vaginal sonograms, and send those video recordings to the care provider, who will then analyze them and instruct them in a structured way what to do next. When we go to the clinical data and the laboratory data, we can say that the cycles that were used using SUT did not differ from traditional monitoring. There were as many eggs, as many ripe eggs, as many pregnancies, as many ongoing pregnancies as in the non-SUT group. When we focus on the follicular phase, the stimulation phase of the treatment, and we went to ask patients and their partners what did they think of the treatment, they found they were much more satisfied, women. The partners were much more satisfied. The partners participated much more to the treatment. The stress of the treatment was much less because, of course, they didn't have to organize transportation to the center, or perhaps leaving a child they already might have somewhere, or other job-related organizational issues. Finally, the discretion that women could have around their treatment was much higher. If a woman would consider to use the system, she might have some doubts as to, am I able to make relevant sonograms? The answer is yes. The whole bottom line of the SUT idea is that even if the images that are sent are not absolutely perfect and do not show all the last small follicles, we can perfectly take the same clinical decisions on the basis of the largest follicles, the dominant follicles, that actually guide us for taking decisions on dosage schemes and so on. So that is absolutely easily feasible. We also teach the women how to handle the probe. It is easy, it is painless, the technique does not hold any risks. They cannot hurt themselves, they cannot tear up any structure inside, it cannot bleed. And by manipulating themselves the probe, they feel until where they can go in handling the probe.
The Sonaura patient imaging system will be delivered in a case. Containing the tablet, the vaginal probe, condoms, and ultrasound gel. To switch on the system, briefly press the button at the top of the tablet. The Sonaura starts immediately. The first time you enter the application, you need to fill in your cycle ID and your PIN code, which is sent by email. In all subsequent cases, you only need to use your PIN code. To start recording a sonogram, you have to plug the ultrasound probe connector in the USB port. Next, you need to apply a little bit of ultrasound gel onto the probe. And slide the condom over the ultrasound probe as far as possible. Then place gel on top of the probe. Now you're ready to start the sonogram. Insert the probe as deeply as possible into the vagina. Gently push as far as you can without any discomfort. You can start the sonogram by touching the sonogram icon. The explanation appears on the screen. It's important to follow the correct order. First, obtain a clear view of the right ovary, then of the uterus, and at last of the left ovary. So start with the right ovary. Position the probe and observe the follicles by pushing the end of the probe to the left. When you push the button, the recording starts. Here below you can see a moving time icon showing that recording is in progress. When recording is finished, you can review it immediately afterwards. If you're not satisfied, you can push "No, try again" and do the recording again. Next, you can move on to the uterus. You enter the probe straight into the vagina and press the button again when you're ready to record. The record icon runs again. When the recording is finished, it will be replayed. Finally, you go to the left ovary and aim the probe as much as possible to the left by pushing the end of the probe to the right. When you're satisfied with the positioning, you can start recording. When the recording is finished, the tablet asks you again if you're satisfied with it. When you push one last time, you have the option to type a message and send it to your doctor. When you press Finish, the message is ready to be sent. The video will be sent automatically. Here you see the blue arrow indicating that the transmission of the recording is ongoing. When the green check mark appears, this means that the video has been delivered to your care provider. If you click here, you can read the response of your care provider. Good luck and enjoy making your sonograms at home.